Well, Gina and Kelly, let's hear from a doctor right here in Kansas City on that. We know that flu season is rolling right along, and already doctors are sounding the alarm. They're saying that this year it's more important now than ever to get the flu shot amidst the pandemic. Dr. Rachel Haley from HCA Midwest explains how to navigate a potential twindemic. Dr. Haley, flu season and COVID-19 are about to crash. What does that mean for the two highly contagious respiratory viruses and how that impacts our health?
Belinda, you are right. As if the novel coronavirus wasn't enough to worry about, this year's flu season is gearing up, giving those already nervous about every cough and sneeze more to fret over. We are concerned about the potential for a twindemic with the COVID virus and the flu virus in full swing at the same time. The flu is a life-threatening respiratory virus that can crowd emergency rooms and ICUs, and it also shares symptoms with COVID-19. The flu can leave patients vulnerable to a harsher attack of COVID-19, and coming down with both at once could be devastating. Last year's flu season in the U.S. was mild, according to the CDC, but a mild flu season can still take a toll. The CDC reports there were at least 40 to 50 million cases last year, resulting in up to 750,000 hospitalizations and from 24 to 62,000 deaths. It's impossible to predict how bad the flu season will be this year, but we want people to be prepared, and that starts with getting a flu shot.
All right, preparation, and let's tie that in with some behavior. So we're wearing masks, practicing good hygiene and social distancing. Why is getting a flu shot a top priority to protect our health?
That's a great question, and one I am hearing frequently from patients. All of the protocols, wearing a mask, social distancing, and staying home when you are sick can apply to the flu as well as the coronavirus for reducing spread of these viruses. But we are facing an enormous challenge this year with two different viruses occurring at the same time. It's more important than ever to get your flu shot. It doesn't just protect you, it protects your family and the community. Vaccinating will keep instances of the flu down, tempering the number of hospitalizations required for this illness, thus reserving medical resources to deal with COVID-19 cases.
And as we work to understand the flu a little bit more, do healthy people get the flu?
Yes, no matter how much you take care of yourself, you're still susceptible to this virus. Here are some important things to remember about who should get the shot, what it does, and how you can still take preventative measures after the vaccine. The flu vaccine is recommended for children 6 months of age and older, and especially for those in high-risk groups, including those 65 and older, pregnant women, and people with certain medical conditions like diabetes, hypertension, kidney disease, and asthma. And even though a vaccine may be less effective against a particular strain, it can still reduce the severity of the flu. And after you get the vaccine, focus on boosting your immune system by eating healthy, hydrating, exercising, and getting plenty of sleep.
Well, it makes sense. Now, we've probably all had friends and family members who've gotten the flu shot, and then they say that they've actually gotten the flu after that. How can that happen?
Okay, let me bust that myth right now.
Okay.
The flu vaccine does not give you the flu. After receiving the flu vaccine, though, you might feel your body's natural immune response to the virus's antigens. You might even feel flu-ish, but that is a good thing. It's your body's way of saying, I'm ready for the flu, and you likely will not get as sick if you do get a different strain of the flu.
Well, for more information or to schedule a flu shot, go to hcamidwest.com.